Oh, there's tape on the stage. I know where to stand. So I just wanted to talk about something that's a little different from the last topics, regenerative NI, natural intelligence. That's what we all have. That's what our brains do. That's what the neural stem cells in our brain do. They actually regenerate our ability to understand what we just went through. So I'm going to talk about one word, one patient, and one product, one drug that we've just made. And the one word is something that defines us as humans, and I think it's part of the longevity aspect of humanity. You hear about resilience. You hear Chris Mason's brilliant talk about everything that we can study from the heroes that go into space. But what's the one word that defines us as human? Altruism. I don't think AI has an altruistic button. I think that's what defines us, whether we're physicians or scientists. We're doing this, as Chris was mentioning, because we want to change the world we live in, hopefully for the better. And that's what I see in Lee Stein, who's actively texting people to connect us. It's what I see with everyone, these evocative, provocative talks. Certainly Dan Kraft wants us all to get along and create new things together. So I'm a hematologist, I'm a scientist, I'm in clinic, and this patient said to me, "You know what you are?" And I thought, uh-oh, I don't know, some people haven't been that pleasant before. He said, "You're barach." I said, "I actually don't know what that means." He said, "It's Hebrew." I said, "What does that word mean though?" He said, "It means you create something out of nothing." And that's what we can do that computers have a hard time doing. They have a hard time inventing and creating something. Now, what I learned from space is that you can create new things that you would never have seen before. They're unique to space. So I'll talk about space-based research, predicting and preventing, accelerated aging and cancer stem cell evolution, and really think about finding where you can see where the most need is and where you can do the most good. And that's what T. Denny Sanford always tells us. And this is what Irv Weissman taught Dan and I when we were both in his lab. Dan Kraft and I kept being told by Irv Weissman, follow your ideas, stick to them, be resourceful and resilient, and don't stick slavishly to a hypothesis that was never correct. Go with the data. And the data has to be new. AI is only as smart as the data we feed it. You have to create new data sets. You can't just go with the old, and it can't just be somatic mutations, or the mutations we get in our DNA. There has to be a functional component because we're all going to respond differently to the same stress. So I'll talk today about stress. And how do we measure this? And what does it have to do with regenerative medicine? When we're trying to coax our poor, tired stem cells, after 3 cappuccinos this morning, I wasn't so convinced my stem cells were going to wake up. We're trying to convince them to regenerate and restore the tissue function that we need them to restore. So I was on a flight, and I was going from Frankfurt, actually supposed to be going to DC. Well, we didn't end up in DC. We ended up having to divert. Now, this patient was having a hypoglycemic seizure. He became a patient, and he was seizing on and off for 2.5 hours. And I had to relearn a lesson I learned when I was in fellowship. Never assume you'll make an ass out of you and me. I assumed that he didn't have a continuous insulin drip, which he did. He had a pump, but it was not evident to me. Anyway, sometimes when we're making new therapies, we assume certain things. We assume we know, we don't talk to our colleagues. In this case, when we talk about making the new regenerative medicines, we have to talk to each other. We have to coordinate things, and it can't be a one-off. I've been involved in, from discovery to clinical delivery and FDA approval, 3 different treatments that are now FDA approved. Interestingly, one of the last speakers talked about photodynamic therapy. Visidyne was my PhD. Drisbo and Rebec are 2 of the other drugs I was involved in. But it was always about a team. Talent, tenacity, teamwork, trust, and track record. We heard about trust earlier. We have to trust each other that we have different ideas and those ideas are valuable. And that's what we get to do with space, and it can't just be a one-off when we make these therapies. So we started the Sanford Stem Cell Institute because Denny Sanford turned to me and he said, "Kat, you seem to have a strong sense of purpose." And I like alliteration. So I said, "Of course, people, purpose, program." He goes, "Enough alliteration. Why do you have that sense of purpose?" And, you know, I see patients in clinic. I only do this once a week. I'm on call 4 weeks a year. But patients need better therapies, and we're all going to be patients, so nobody should feel stigmatized by that. 1 in 3 of us is going to get cancer, maybe more than 1 in our lifetimes. So this is a very important thing to predict, prevent, and reverse. So we have 6 centers of brain tumor and neural restoration program. And when you look at regenerative medicine, there's altruism, but it's also a very profitable opportunity. It's valued at $32 billion for the regenerative medicine market to get stem cells to regenerate themselves, or we can have cell replacement therapy. We know that we can make new therapies in space. Now, there's an opportunity for biomanufacturing and commercial intellectual property development. Why space? Things happen faster in space. Our stem cells age faster. Tumors grow faster. There are unique opportunities to do protein crystallization, which happens faster. So Catriona is one of the most widely used drugs for cancer, but you had to be tethered to an IV pole. People don't like that. Well, in flight, BMS and Merck decided to try and get the protein crystal structure of Catriona binding to its target PD-1, and that led to an injectable. You just zip in and out of clinic, 10 minutes, you're done. That formulation change was a game changer for patients. So space heals. Space has value for all of us who want to heal people and heal ourselves. When we first started working in space, this was back in 2020, with a NASA Integrated Space Stem Cell Orbital Research Center grant, I-SCORE. I grew up in Canada, so I like hockey. Everything, you have to take shots on goal to score. I thought, you can't bring products back from space without landing them in the ocean somewhere. That's a very tough thing to do if you're in biotech and trying to make new products. That's all going to change because Dream Chaser, the space plane, is going to take off soon, and we'll be able to land the products in spaceports. And that's going to happen hopefully by the end of this year. But I think the key lesson that space has taught us is about stress. As Chris Mason was alluding to, space is a stressful place, and we all respond differently to stress. But in space, we can see the effects of stress on humans faster. So the NASA Twin study demonstrated that repeated or protracted periods in low Earth orbit, LEO as it's affectionately called, induces immune system changes. Dan and I trained to do bone marrow transplant at Stanford together. That's an important one. If you have no immune surveillance against cancer, your cancer is going to come back. Or a cancer that was pre-cancer will become full-blown cancer. And that's what we saw in Scott Kelly, the pre-malignant changes in the blood and increased inflammatory growth factor expression. So I saw all this increase in inflammation, and I thought, wait a minute, those are the same factors that actually lead to the activation of a set of enzymes that we all have that are unique to humans. You can't study this in a mouse, a fruit fly, or a zebrafish. And those are called base deaminases, base editing enzymes. So we have base editing enzymes to protect us from viruses like HIV. But one thing about our genome is we've got the dark genome. Who here has heard about the dark genome? Yeah. So the dark genome is 55% of our genome. 55% of our DNA is comprised of human endogenous retroviruses that are old viruses that invaded our genome and long interspersed nuclear elements. So these enzymes evolved to protect us from our own dark genome, or what my mom calls the Darth Vader of the genome, because you inherit it. That can come out under conditions of stress, and that plays a role in cancer development. So this is work that was done at the Sanger, and a lot of people have worked on what these repetitive elements do if they're unleashed. They activate these enzymes like ApoBec and ADAR. They edit our DNA and our RNA. The editing of DNA leads to mutations. Can you imagine? ApoBec activation is the #2 signature in all cancers. It doesn't matter what kind of cancer you have. #2 signature in all cancers is caused by this enzyme that's induced by stress and inflammation. So how do we study that? It takes years on Earth to have your cancer go from early stage to late stage. How do you study stress-induced cancer, especially when it blasts off, which is what happens to my patients when they go from a pre-leukemic disorder to leukemia, as I was reminded yesterday when I was in the hospital rounding on somebody who was quite scared about this. Anyway, stress-induced activation of these base editing enzymes can fuel pre-cancer to become cancer. Why didn't we know about this before? Because ApoBec3 enzymes are human or primate specific. They're not expressed in mice. They're not expressed in zebrafish. There's only one reductionist model system to study that in, and it's us. It's humans. You have to study humans. Well, what happened with NASA? They decided to have the decade of results, and they're focusing on human biology, and they're very interested in stem cell biology. So what APOBEC does is it activates mutations in our DNA. ADAR, which has been on our radar for 10 years, then actually acts as a dimmer switch for APOBEC, but it goes overboard and it starts to edit our RNA. So how do you look at these stress-induced enzymes? With NASA, we made what I call canaries, cancer and aging stem cell nanobioreactor artificial regenerative intelligence enhanced systems. I love acronyms. Sometimes they get a little long. But anyway, these canaries, as I call them, they're stem cell fitness tests. We can put your stem cells, we'll put them on this little sponge, it's in a pediatric blood bag, and we'll see how your stem cells are behaving. Are they stressed? Are they dividing too often? If they're red, by the way, they're asleep. If they're green, they're in cycle. If they're yellow, they're dividing. Why did we make this cell cycle reporter? Because there was a Nobel Prize winner we worked with, Roger Chen, who said, Kat, cancer can't get stem cell properties. It can't divide and then go to sleep and become red with this reporter. That's BS. And I said, Roger, would you mind helping me to prove or disprove this hypothesis? He goes, okay, it's all about science. Anyway, so what we found is normal stem cells like to be asleep 80% of the time. Cancer stem cells can also do that. They can wake up, they can divide and go to sleep. The problem when cancer goes to sleep is when it wakes up, it clones itself, and it does this very dramatically because of that ADAR enzyme that you see in green over there. So we developed these systems so we could study stem cell aging in space, and what we found is on the ground we retain all of our red, nice stem cells, but in space the stem cells get exhausted and you lose the red, healthy, sleepy stem cells, and they're awake too often. And you know, the way things happen in space, it's time and space dependent. So your telomeres actually prevent your chromosomes from unraveling. They were discovered by Elizabeth Blackburn. She got the Nobel Prize. But what we found is it's not just enough to extend your telomeres, you have to maintain them. And we see problems with both, with people having changes in their telomeres. Now, these are in purified stem cell populations. So we're seeing problems at the telomere level. But I think the surprising thing was when we send our nanobioreactors with stem cells into space, this is across 4 missions, we see 5 times more mutations in space than ground controls, and only about 20% of those are from radiation. So it means the rest are coming from activation of stress-induced enzymes, and that's APOBEC. So why is APOBEC getting activated in space? This is unleashing the dark genome. It gets activated in space. It gets activated under conditions of stress. And what surprised us was that it's really the defining feature of space. We activate the dark genome. So that was in the nanobioreactors with stem cells. It wasn't in whole people. So we started to say, what happens in the astronauts? These are primarily private crew, except for Peggy, who's one of the most decorated US astronauts. I think she's done 640 days in space. So we looked at the Axiom 2 and 3 crews to look at space-associated stem cell hallmarks of aging, SASHA as we call it. And what we found in this is they also activate the repetitive elements or dark genome. They do it more if they're in space for longer. And then they get activation of this APOBEC enzyme if they're in space for longer. So 10 days is okay, 21 days activates that mutating gene. And they actually get a lot more mutations if they've been in space longer. But here's the good news. The astronauts recover. A lot of those stem cell mutations go away. So it means our immune system is resilient, and we can actually take advantage of understanding in cancer, why is the immune system fooled? Why doesn't it know that the cancer is there? Well, back to this enzyme ADAR1. So this has been on our radar for a long time. It allows cancers to clone themselves, and there's one splice isoform, P150, that does that the best. And it also allows cancers to evade the immune system. So we took those nanobioreactors that we made together with NASA, and we look at GBM, glioblastoma. It activates ADAR there. We made a drug. This is the one drug, and this goes back to altruism. This was funded not just by the California Institute for Regenerative Medicine and NASA, but actually one person, Rebecca Moores. So we called it Rebecsinib. So it's named after her. This drug was a tough drug to make, and we just got safe to proceed to clinical trials from the FDA on Pi Day, March 14th. So I'm just announcing this for the first time. I haven't given a talk about this yet. It's the first drug to have its development path accelerated by space, targeting cancer. So I was chatting with NASA this morning. They're pretty excited. I'm always trepidatious about these things when you go into clinical trials. You don't know what it's going to be like in humans. So we'll be entering clinical trials soon. But the plan is we think this will work in 20 different cancers. Now, how did we do this in space? Jessica Pham helped us test this drug in space in these little nanobioreactors with that GFP protein. What we found in space is cancers triple in size in just 10 days when it would take 10 years on the ground to get that. They activate the target gene of this drug, 8R1. And here's Walter Villaday. So here's one of the astronauts. So Walter is looking at triple negative breast cancer organoids. This is a very aggressive tumor. He's making sure that our nanobioreactors are in the right orientation. And it matters because one has the drug, the other one doesn't. What did Walter discover and what did Peggy discover as our partners in space and science? They discovered that Rebecsinib, as opposed to this other drug, fedratinib, or the control, is really stopping cancer in its tracks. And if you're not growing, you're dying as a cancer, so we called it a cancer kill switch. So this got into Fortune magazine, which is the first time I've ever had raw data published in Fortune magazine. But that really accelerated our idea about working with NASA and related partners to develop drugs in space. So what we're really trying to do is predict, prevent, and reverse accelerated stem cell aging, pre-cancer, and cancer in all of us. What we've learned in the astronauts, we can do in all of us. We don't have to wait. Why wait? So we should all have stellar health care. We should all have therapies that work for us, but it's based on natural intelligence, working with human teams, because we're the ones that generate the data sets and the functional algorithms to test that. So I'd really like to thank Daniel Kraft for inviting me to speak here, and everyone who's hopeful about the future of medicine. What's next? We're going to be making new therapies with these happy crews that don't care if they're upside down, backwards. They'll help you.
3, 2, 1.
That's the future, and it's exhilarating. But when you see my patients here, I talked about one patient. It's Sandra. The other one is Noah. I bet you can't tell who the patients are, and you shouldn't be able to. The one on the bottom is Patty. This is for people purpose program. That's who we do this for. It's why we do what we do. And space is helping us to uncover new solutions. And that's Becky in the right lower corner. She's not giving up. Why would we? We're getting ahead. So that's the future. And the future is about people working together. So I'm really pleased to be here. I don't think there's going to be time for questions, is there? Okay.
Thank you, Kat.
Thank you.
Amazing work.